You are angels. You heal, you cure, and you save lives. Yes, ladies and gentlemen, join me to welcome the team of doctors to our show Talk2ME.
I am student journalist Pooja Jaswal from Sandeepni Journalism Club.
Today we have with us on our show legendary Dr. Bhupinder, Senior Medical Officer Pathankot, veteran pediatric Dr. Sunil Ghai, and eminent gynecologist Dr. Anuradha.
These notable personalities need no introduction. They've been playing a very prominent role to provide good healthcare and support the city during lockdown due to coronavirus.
Doctors, we are honored to have you with us. Let us start our conversation.
Dr. Bhupinder, sir, briefly share your journey with the audience, from a common man to a health professional as an SMO.
Hello friends, I am Dr. Bhupinder Singh, presently working as SMO Civil Hospital, Pathankot. I belong to Pathankot only and my schooling was here from Pathankot, but later on I was given scholarship and I was shifted to for my higher studies. I went to DAV Amritsar and from there I got selected into medical college and I did my MBBS as well as MS in otolaryngology from Amritsar Medical College. Then I got this job as PCMS officer, medical officer. I joined in Narod Jamal Singh in remote area, served there for 7 years and then was posted at Pathankot. Presently I am working as SMO Pathankot.
Dr. Anuradha, we would love to know that why this ongoing pandemic is known as novel coronavirus.
This pandemic is called the novel coronavirus because this virus is a new strain of a virus which has never been identified in the human race before. So a lot of research is going on to know more about this virus. So the word novel means a new virus.
Dr. Sunil Ghai, are coronavirus and COVID-19 two different terms?
I would like to say that corona is the virus which causes the disease which is termed as COVID-19. COVID-19 means coronavirus disease of year 2019. So what difference it makes is that corona has been prevalent since last so many years and the disease it has caused now is COVID-19. Previously in 2003 it caused a disease which was known as SARS-CoV. So now it is novel coronavirus. These are the differences. Just like in AIDS and HIV, AIDS is the disease, autoimmune deficiency syndrome, which is caused by HIV virus, which is known as human immunodeficiency virus.
Initially, it was told by MHA and WHO that the person having cold, cough, breathing or respiratory problem may have corona. But now we are hearing something about asymptomatic corona. Dr. Bhupinder, please share your insight about it.
The biggest problem the whole of the world is facing today is that of the COVID-19. Coronavirus, which originated from China, has now become a pandemic and all over the world it is creating troubles. Right now in Punjab, in India and in Punjab, it's going on. And we have got 16 patients right now admitted in the civil hospital Pathankot who are COVID-19 positive. And all over Punjab and all over India, you know the situation which is coming up. And every day the cases are rising. The big today we are facing with the COVID-19 is that it's asymptomatic in about 85% of the 80 to 85% of the cases where patient hardly gets any problem or a little bit of slight fever and slight cough and then the patient is alright. The problem is that the patient is carrier because the patient can give this coronavirus to anybody nearby. So they are the biggest problems because it's very difficult to find out who is corona positive amongst the asymptomatic patients because they are just working as a normal person. As far as symptoms are concerned, we have got very clearly COVID-19 symptoms are quite like flu cases, but with the difference that it sometimes causes are this difficulty in breathing. Fever, dry cough, difficulty in breathing, these are the three main symptoms, but along with that, diarrhea, myalgia, other pains can also occur. So COVID-19 as such is a disease which is now spreading its tentacles all over the world.
Dr. Anuradha, what is the difference between self-isolation, self-quarantine and social distancing?
Self-isolation means a person who is infected or who develops symptoms of sickness, say cough, fever. This person keeps himself isolated from other healthy individuals. This is the word self-isolation. Means self-quarantine means that a person who's not infected, this person is not infected but has a suspicion of coming in contact with a person who probably may be COVID-19 positive. Say it may be a doctor or a frontline health worker, or for that matter anyone from your household also, who has a suspicion that he has come in contact with a corona positive patient. So this person A will quarantine himself, that is keep himself away from other persons, even his family members, for a period of 14 days. So this person A who has a suspicion will keep himself away, that is locked down from other persons. Social distancing literally means physical distance. That is that you keep a safe distance between yourself and the other person, which in this COVID-19 means say a distance of 6 feet from you and the other person. This is social distancing. And don't go to any crowded places where the social distance may not be maintained.
Dr. Ghai, we would love to know that despite so much advancement in the medical science, why we are failing to discover any medicine or vaccine to combat this coronavirus.
It is a deadly disease, and I would like to tell you that making a vaccine is a long, cumbersome procedure. It has to pass through 6 developmental stages, and then there have to be 3 human trials. Usually a vaccine to be developed takes around 7 to 10 years for a disease to develop a vaccine for that. But having said that, I would say that there are multiple companies, multiple countries, they are working on this to develop a vaccine for this disease, and in a very fast manner. All the clearances from WHO, from United Nations, from various countries have been given to these countries because this is spreading like in a very big way. So all the formalities are being done in a very fast manner, and we expect that a new vaccine would come in the near future to save our generations from this deadly virus. And regarding medicines, it is not that no medicine is available. There are trials going on in certain countries over lots of medicines, and people are responding to these medicines. There are a few protocols which I would not discuss here, but various medicines are being given to the patients suffering from COVID-19, and they are responding very well to these medicines.
Dr. Bhupinder, in your entire tenure in this healthcare profession, I'm sure you would have come across numerous diseases. But have you ever seen so devastating disease ever earlier? If yes, then which they were? And if no, then how is this disease different?
As the challenges are concerned, health as such all over the world has faced so many of challenges in the last so many of thousands or hundreds of years. But pandemics have been very difficult to tackle, because whenever these happen, whole of the world is at risk of the disease. We have faced smallpox, as everybody knows that it was a very dangerous disease, but we were able to eradicate it. Then we have TB, we have HIV, we have HCV like hepatitis C, and many other problems which are creating so much of trouble in the world and always a challenge. Along with that, of course, we have obesity, we have diabetes, we have non-communicable diseases. But the COVID-19 is different in one way, that it is a very, very highly contagious disease. Coronavirus can spread by touch, by the cufflets, or any and many other these methods. But the problem lies with the things that it stays on the surface at certain surfaces for more than 24 hours also. So one has to be very, very cautious when we tackle this problem. The biggest problem lies with the 5 to 10% of the cases where there is comorbidity along with the disease, or comorbidity like diabetes, hypertension, obesity, or any other form of tuberculosis, any other even bronchial asthma also. These are the comorbidities which create trouble along with that. But along with that, we have certain other challenges which COVID-19 is giving. That is because the patient suddenly becomes very, very hypoxic and difficulty in breathing, and then the patient is put on ventilators, and so many of patients don't come back.
Dr. Anuradha, kindly tell us, what challenges can you anticipate post-lockdown? And how well prepared is Indian health system to tackle and combat upcoming situations?
In the post-lockdown period, we can anticipate many challenges. But today, I'm only going to talk about the health challenges. Now, when the government restrictions are put away, so the onus rests all on us. How do we maintain social distancing? How well do we wear our masks when we go out in public, wash our hands, use sanitizers, and avoid crowded places? So I want to really stress that onus is on each one of us today, how we can inhibit the spread of this virus. In my opinion, our health system is very well equipped to deal with all the health challenges. See, despite being the second largest populated country in the world today, we have maintained the best control over the spread of this deadly virus.
Dr. Ghai, as a pediatrician, inform us that how far and why these young children are so much vulnerable to this deadly disease, corona.
I would like to say in the beginning only that there's a good news that our children all over the world, they are rather less vulnerable to this disease, which is a very welcome sign, welcome thing to happen. It is, the reasons are not very well known why the young children in the pediatric age group, they are less vulnerable to this age. Saying all this, I would like to say that all children have to be saved from coronavirus disease, because once they get it, it can go out of hand, because there are certain diseases in children like asthma, or there are other diseases like diabetes, comorbidities in children, in which cases these children, they can get it more often. So I would request you all that you have to take care of your children more carefully, because they are prone to so many diseases otherwise, and this disease becomes common in them if they are unduly taken out. They are not following the norms which have been set up by the government, like social distancing and wearing masks, and if they go near to the other people who are infected, because corona, you never know, is it prevalent in any person who is passing by you or coming to you or meeting you. So all people, they have to maintain proper distancing from their children.
Last but not the least question for the day. Doctors, any message for kids, adults and senior citizens?
One advice I want to give to whole of the society, particularly the kids and the elderly people, that this disease can very easily be managed by social distancing, by other cough etiquettes, like we should cough in the elbow, by not going near to the patient who is having cough or some other symptoms, and there are other things which we keep on telling the patients. The biggest problem that lies with this disease is with the patients who are elderly, above 65 years of age or above 70 years of age. They are the people we have to protect. So my request to the kids, to students and to the adults who are working or who are coming out of the house is to stay away from the adults. The biggest thing, the first thing we should do is to save our adults so that they don't get infected. As long as they don't get infected, we have lesser serious problems, serious patients. So this is my request that follow up the things which are very, very essential, like mask wearing, like staying away, social distancing of at least 1 to 2 meters, and then cough etiquettes. Then hand washing is very, very important. We keep on telling whether you want to do it with soap and water or sanitizer, whatsoever is available is highly effective. So my request is to be cautious, stay home, stay safe, and all the best to all my friends, colleagues, kids and adults.
Lastly, I think I should conclude with my message to the kids. The children, I know you must be badly missing your friends and your outdoor activities. You have to stay home for a few more days so that we can control the spread of this deadly virus. Thank you.
My advice to children, adults and senior citizens would remain the same for all. That wear mask, hand sanitization and social distancing. Our government has really worked hard to keep the count low because of these lockdowns and various measures they have taken. So the foremost thing I would tell all is hand sanitization for 20 seconds with soap and water is the best way. I would tell all children to learn hand washing technique, and for 20 seconds what they can do is they can speak ABC till Z. This will make approximately around 20 seconds while the time they are washing their hands. Secondly, for the mask, I would say that a simple cloth mask would suffice for all. This should become a norm for few months from now onwards, that we should be wearing a mask most of the time when we are stepping out of our house. And social distancing is the norm for all.
Dear audience, so we take an advice from the team of doctors to follow the guidelines strictly. Stay at home until it's very important to go out. Wear masks, wash hands regularly, and very important, maintain distance everywhere.
So with this, we come to an end of this show. To conclude, it may be noted that COVID-19 is a manageable disease. To combat it, we all need to be more self-disciplined, need to have self-control, adapt to the changing environment, and amend our habits. Special care has to be taken of senior citizens. Remember, only one thing which is permanent is change. So stay positive and keep watching our show, Talk to Me.